Well, welcome. We are so happy you are here and happy to have you here for this fourth program in our 2022-2023 Focus on Seniors series. We'll be discussing benefits enrollment today. And we thank you so much for coming, and we especially want to thank our co-sponsors, our wonderful partners at the Blount County Community Action Agency Office on Aging, Teresa O'Mary and her staff and partners who have come today to help share information as well as hold appointments with people who may be interested in having a screening today. Before I say any more, I did want to mention we are recording the program today. So if you would be kind enough to hold your questions until the end, we will stop recording at that point just to respect your privacy. But we do hope to have the recording posted on our YouTube channel, before too long. If you'd like to tell someone else about it or watch it again. If you haven't had a chance already, we'd love for you to stop by the tables and pick up some information. We have lots of good information there and about volunteer opportunities and other things going on here. Also we have some information from the library, including our library newsletter. We have lots of things going on right now here at the library. Including programs for kids and grandkids, as well as adults. You'll notice in the newsletter we do have another program in the Focus on Seniors series coming up in March on the 15th. That will be Matthew Harrelson, who's a specialist in elder care law, and he'll discuss wills and trusts and powers of attorney and all those important documents that we need to have peace of mind. We also, I'll mention, we have the Seed Library open again. That's been very popular in the last year or two, and it's not only fun, but it's a great way to save on groceries, grow your own vegetables and things. So, I know that Teresa will have lots more information on ways to save money, and I know you're eager to hear what she has to say. So I'm going to turn the program over to Teresa O'Mary, who's Director of the Blount County Community Action Agency Office on Aging. Thank you so much.
Thank you for participating in this presentation. Also in April, on April the 19th, we have Dr. Kevin James will be here talking about aging and cognitive impairment and dementia and the normal aging process for all of us. So remember, March the 15th and April the 19th are the next two series we have coming until we start back again in the fall of 2023. Okay? Excuse me, my sinuses are really killing me this morning. Anytime we have this weather, it picks up. Today we're going to talk about benefits screening and seniors and individuals who are receiving Social Security disability income. If you are either one of those categories, then you're in the right place. You can receive disability income and still be in your 30s or 40s. You don't necessarily have to be a senior. And there's a lot of information here, and like Melinda had said, hold off majority of your questions to the end. I promise you I will stay and staff will stay to answer your questions as a group, as also as an individual. After this meeting, we have 3 of our benefits enrollment specialists that are going to be here. I know we've already got appointments, some appointments set up, but we will take some individuals who have not scheduled an appointment. With that said, let's move right into it. I'm going to tell you just a little bit about the Blount County statistics. Some of you might know this and some of you might not. But just real quick, in Blount County alone, there's 28,897 individuals that live here that are 65 and older. That's 21% of our total population here in Blount County. Was anyone aware of how high? We are the highest in the whole state of Tennessee of any county Tennessee, as well as our national average is higher in the U.S. in a county, in a state, for seniors. So this is a great place to retire, right? I can't think of any other place, you know, being here in the great foothills of the Smoky Mountains myself. The other information which is really interesting is 24% of our seniors live alone. 25,237 individuals back in 2019 were on Medicare. I don't have the 2023 numbers, but just alone, that many individuals were on Medicare in Blount County. These are all for Blount County. 39% have 4 or more chronic illnesses. 1,940 ER visits are due to fall annually alone. And 24% of our seniors are mobility impaired, have mobility issues. 20% pay 30% or more of their income for housing. That's a big issue. I mean, huge on a fixed income. I don't know if you're renting or you're a homeowner, but a lot of our individual seniors who were in affordable housing here in Blount County, who were renting, are no longer housed, you believe it or not. They got 30-day notices, 45-day notices. People who were renting homes and individuals who owned the smaller apartment complexes sold out, and they're tearing them down. Even some of our mobile home parks have been sold out to investors to build development and homes. So we have a very large, high number of homeless seniors right now in our community. 1,465 seniors in our community are raising their grandchildren. And that's becoming higher and higher as each year goes by. And I want to bring out that we have volunteer opportunities to assist in the foster grandparent program. That's where you volunteer to go into classrooms or assist with whatever age group, K through 12th grade. Right, Haley? Right. And we'll talk more about volunteer opportunities later. 22% of our Blount County residents are veterans, and 2,217 make less than $12,490 a year. The Office on Aging in general, just a show of hands real quick. How many of you all know there is a Blount County Office on Aging? And then the rest of you have never even heard of the Office on Aging. Well, this office has been around since 1965. We assist anyone that is aging and who has a disability in the community with finding resources and information. If we cannot provide assistance in whatever service that you might need or help, we will work with you and try to find that help. And that's talking about our information assistance. This sheet that I have laid out for everyone, this is pretty much what I'm going to talk from. I'm not going to mention every single thing on here, but there's a few things I want to point out. So if anything else, this sheet and the little blue placard brochure, make sure you take that with you, because that is just full of information. Either you will have benefit from that information, or you will know someone eventually that will benefit from that information in your community, at your church, just a neighbor. You never know. We produce the Senior Service Directory for Blount County. There are copies of them over here on the table. This we publish this every 3 years. We've already gone to print for our new one, and it'll be here in about 3 weeks. So just keep that in mind and you get an updated directory. We do, through our office, Medicare counseling. So during open enrollment, we work with our SHIP office. That's our state health insurance program, and help you identify policies and sign up for Medicare. We have a numerous amount of resources available in our office, printed material as well as electronic material. They can be mailed, you can come by pickup, or we can email that information to you from whatever topic. If you have been diagnosed with something and you don't understand your diagnosis, then we can help you identify materials and possibly support group or information about that diagnosis. Just keep that in mind. Something that I want to bring up, it just popped in my mind, that's not listed on here. We get a lot of seniors that get mail either from Medicare, Medicaid, or some other insurance company or something that they don't understand. If you get something in the mail you don't understand, you're more than welcome to call our office, come by, and we can review that with you. If you don't feel comfortable talking with somebody from the Social Security Administration, talking with somebody at Medicare, we will do a three-way call with you. You don't have to leave your home, and we can advocate and assist you with that and try to find out. We can also review the material to make sure it's not a scam, because a lot of material that you get is scam. Okay. There are a lot of opportunities out there for individuals for free phones, free government phones, as well as an internet subsidy. A lot of our seniors don't realize that they may qualify for that. Their household may. So you'll never know unless you're screened for benefits. And I just want to let you know, when I say screen for benefits, it's when you talk with someone over the phone or you sit down with one of our specialists and they ask you certain questions, and based on the questions that you provide, they can determine what kind of benefits that you can qualify for. And we have software in our office that will look at the local, the national, the state, and the federal level programs and see what kind of information that you and services that you qualify for. A lot of our seniors who have limited resources have a heating and cooling unit that go out either in their mobile home or their home, and cannot afford. I just replaced mine, and I can tell you, I had to take a loan out. It's just outrageous to replace a central heating and cooling unit. There are programs, if you live in certain areas in this county, through the TVA, the Tennessee Valley Authority. It's called the Uplift Program. We have done a lot of applications for seniors and gotten them free installation of a new unit and for their home. Okay? You just have to own the home. The requirements, you have to meet certain income levels in the household, but you also have to own the home. It can't. If you're renting somewhere and you're without heating and cooling, we want to hear about it, because that's a landlord issue. Anyone you know that has become disabled, either through long-term COVID, long COVID, everybody's heard about that, or an accident, we can assist with the disability claim process. We can help you identify professionals in that field and answer some of your questions. Make three-way calls with the Social Security Administration about your claim that you might have already filed on your own. We can help with those as well. We get a lot of calls about a self-employed caregiver list. We have a lot of individuals who have parents or a family member who needs caregiving at home, and they not necessarily qualify as a limited resource individual, and so they can't get free home health care services. Medicare does not pay for home health. Now, if you have an injury and you need rehab and recovery and assistance, then Medicare will pay for a certain amount of that time for rehab, only if you're improving. So you may have a loved one, a spouse, a family member that has been diagnosed with a recent cognitive impairment, one of the Alzheimer's or dementias, and you need respite care, you need someone coming in a couple days a week just to help with them, then we can help with that. We have a caregiver list of individuals that live here in Blount County that do that for a living. And then if you have limited resources, or the individual that needs assistance has limited resources, we can apply for Teen Care Medicaid under the Choices program. And we'll talk more about that later, which will pay for anywhere from 15 to 30 hours a week of caregiving services within the home. The next three, the Ombudsman, Adult Protective Services, which is an acronym for APS, and CREVA, Collaborative Response to Elder and Vulnerable Adult Abuse. We work very closely with these three agencies. If you are aware of abuse, neglect going on of an elder or a disabled individual, it's your responsibility to report that. We want to know about it. And a lot of times there's no findings, and there's, it's legitimate, and but a lot of times there's cases where there is abuse, not just physical abuse and emotional, but financial abuse. So if you know someone that's being taken advantage of by one of their children that's a senior, and you're very, very concerned, we can get the right people involved. We work with all of our homeless advocacies and coalitions here in Blount County to help locate housing. A lot of times we have to send people out of Blount County because there's just not enough affordable, low rent housing available in Blount County. We see a lot of new apartment complexes going up, but they are not low rent. And the ones that are designated as low rent for like a housing voucher or something like that, they're very limited. There isn't enough. Under the education and advocacy section, we have what's called a Senior Action Council. And I'm just gonna let you know that we have a group of seniors in our community that meet on a quarterly basis to discuss the needs and the needs assessments in this community and how to meet that. Our Senior Smiles Transportation Program was birthed and born out of that. It was identified that there were seniors in the community who needed transportation services within Blount County to the doctor's office, to the grocery store, for hair appointments and those kinds of things. And so that's how the transportation program got started. One of the other things that we identified a couple years ago, when we started this benefits enrollment program, we saw a lot of individuals leaving the hospital that had a recent amputation or ended up with mobility impairment for different reasons: stroke, amputation, an illness that was going to keep them in a wheelchair, or at least in a walker or a rollator or a cane. And so negotiating steps was next to impossible. So we have a ramp program. And I don't know if anybody is aware of this, but we work with Blount Memorial Hospital on referrals, as well as individuals who need ramps put in their home. We have temporary aluminum ramps that we can set up as an immediate need. And then we have a group of volunteers that come out and build the ramp. And we get grant money for the lumber and the materials to build, and we rely on our senior volunteers in our Safer Homes program to build those ramps on the home. We have a telephone reassurance program for individuals 60 and older. If you know someone in your community, in your neighborhood, or at your church that could receive a call or should receive a call, check in, like a welfare check once a week by a volunteer, just to make sure they're okay. We can sign them up for that program, and we will monitor them. If that individual who is the volunteer caller calls and they aren't able to get a hold of them, we will take action and either send a patrol patrol officer out to check on them, to do a welfare check and make sure everything's okay. That is a great opportunity for you as individuals. You like to talk on the phone, we sure can use you as a volunteer to do that. If you're filing for any kind of Medicare or Medicaid product in the state of Tennessee, we can advocate for you. We can become your authorized representative. We do that for a temporary basis for the application, just during the application process, where we will receive copies of the information that's mailed to you from either Medicare or Medicaid, the Teen Care office, and we will negotiate and do the application with you as well. If you're denied benefits or services, then we will appeal. We can file appeal on your behalf and help you try to get the services that you need. We've been very successful with this program by taking ownership of being an authorized representative and assisting individuals with it and following through. I will talk more about that under Savings Checkup. We can move right into that. Where it says Medicaid Home Health Services, why didn't y'all tell me I wasn't moving along here? Nobody was saying anything to me. How dare you? I am so sorry. I'm not used to doing PowerPoint. I'm just used to talking. And I never shut up. And I've already talked about all this. Oh my gosh. I am so sorry.
But they all fit somewhere on that.
I know, my golly. And it's being recorded. Anyway, on the Savings Checkup, through the Benefits Enrollment Center, when we apply for services for you, either home health care or nursing facility placement where the state assists with paying of that, or under the Medicare Savings Program, or energy assistance, or food assistance, or prescription drug assistance, which I'm going to talk more about that. That money goes back to Blount County. Either the Part B premium for Medicare is put back in your check and isn't taken out each month. You're getting it through savings, through co-pays and deductibles, or your premium costs. But in 2019, $3.5 million of value of benefits were brought back into Blount County just by having this Benefits Enrollment Center and assisting with these applications. And everybody thinks that you have to be below the poverty level. That's not necessarily true. And I've printed a copy of all the poverty guidelines levels, and we'll talk about that. Under the Medicare Savings Program, the Part B premium, the medical premium that comes out of your check each month, and I think is it $164 this year? I think it is. I think it's $164 that comes out each month on your check. There's 3 tiers. There's called a qualified Medicare beneficiary, SLMB, and QI1, 3 tiers of income levels that you can qualify to get your Part B premium put back into your Social Security check. You'll never know unless we do a screening to see if you qualify for that. Looking at this chart on the poverty guidelines, under QMB, you have to be right at 100% poverty level or just a little bit above. And what that means, if your Social Security, gross Social Security check, before they take anything out of your check each month, if it falls between that number, the actual number is $1,235. If your gross income as an individual was $1,235 or less a month, you qualify under the Medicare Savings Program as a qualified Medicare beneficiary. What that means, is that Part B premium, that money gets put back into your check. All your co-pays and deductibles are paid by the state. So Medicare pays 80% of your medical expenses, your medical and hospital. Under QMB program, the 20% is paid by Medicaid under the qualified Medicare beneficiary, if an individual is that low income. If you're married and you're joint between you and your spouse, your household income is $1,663 a month gross income, then you qualify under QMB. There are two other levels. 1,478, you qualify under Medicare Savings Program, and then under QI1, $1,660 as an individual, you qualify. There's a lot of factors that go into the application that when you do get screened for benefits, we can explain those to you. But if your gross income includes your pension, your Social Security check, any kind of monthly income that you're getting, gross income, has to meet those income guidelines. Under the Medicare Part D subsidy, you can get extra help with your prescriptions, co-pays, and your monthly premium as well. And those are much higher. You can make up to $1,843 gross income as an individual and $2,485 as a household of two, as a husband and spouse, as a married couple. If you have more than one individual living in the household, but it is not a spouse, it's not counted under the Medicare Savings or the LIS. You're counted as an individual, as a Medicare recipient. Okay? I get a lot of questions about that. Under the Medicare Savings Program, as well as the Medicare Prescription Extra Health Coverage, you're allowed to have cash resources. A lot of people think, well, I can't have any money in my bank. Well, you're allowed as an individual to have $9,090 in your bank account under the extra help for prescriptions, as well as the Medicare Savings Program. If you're married, you're allowed to have $13,630 in cash resources. Okay. Medicaid, which is their 10-Care Choices program I mentioned earlier, that's for home health care services as well as long-term care and placement. If you as an individual need home health care services and you need help with your activities of daily living. Activities of daily living is transferring. You cannot get from the bed to the chair or from a chair to standing position or walking without assistance. You have to have hand-on assistance for mobility and transfer. You're bathing, you're unable to bathe, you're unable to dress. You have to have assistance with feeding. Someone can prepare your food and set it in front of you, but if you are unable to feed yourself, that falls in that category as limited activities of daily living. And there's more to that as well. And we'll pre-screen you on activities. If you know, if you're driving and you're mobile, then you're not going to qualify for any kind of home health care services or nursing facility placement or assisted living or anything like that. But you may know somebody, or you may become in need of those kind of services. So just be aware of those things for individuals and yourself. SNAP benefits, that is a food assistance program, and to qualify that as an individual, $1,771 as an individual, as long as your gross income, as long as you have shelter costs and medical costs that bring down your income to $1,074 a month, you can qualify for food assistance. Okay? So what that means is you get your Social Security check after you pay your rent, your mortgage, utilities, your phone bill, you pay your Medicare premiums, you pay your prescription premiums, and your prescription copays. You've got your 4 or 5 medications and your monthly costs. After you can count all of that, if it's at or below $1,074 after you pay down those expenses, then you can qualify for food assistance. If you're a married couple, $2,396. Okay. Energy assistance. We have energy assistance for your utility bill, whether it's electric, gas, or propane. You can get assistance with your water bill. And we have, in some areas, assistance with sewer pump help. And you'll never know if you really qualify for that unless you get screened for benefits. But as an individual under the Energy Assistance Program, $2,205 a month as an individual, you can qualify for energy assistance. And it's a one-time, once-a-year grant that's given to you. It's issued to the utility company that you have your service with, and it can be anywhere from $300 to $800. And so you can draw down on that credit. It's a credit, an $800 credit that's given to your utility account. And as you use your utilities, you can either pay $50 a month and then use the rest for your $200 bill and use it like that. Okay, yep, I'm going to move the slide. At our agency, we have a commodities food distribution, and that's done quarterly. So March is our next one. Just call and confirm when the date is on that. I've already talked about the energy assistance. We have a garden produce for fitness under our community service program, and you can get seeds and plants up to $50 if you qualify under that program. We do have an emergency dental assistance where extractions and dentures, for dentures, you just need to contact our office and see if you qualify. If you have been displaced in employment and you're looking for employment, we have employment gas cards to help you with your transportation costs to find employment as well. There are temporary services, and I'll be honest with you, they're very limited with rental and mortgage assistance. And there is what's called utility assistance under Share the Warmth. I don't know if you get underneath on your statement with either alcohol utilities or any Fort Loudon or any utility companies, it will say, would you like to donate to Share the Warmth? And that's what that money is used for. It is used to help those who have already got utility assistance, but they are really struggling financially and they need additional assistance. They're going to lose their utilities. Under our community nutrition programs, we have our Smoky Mountain Meals on Wheels. That's for 60 and older. You have to be immobile. You cannot be driving. You have to be able to, you're homebound, pretty much. Under that program, you're 60 and older, you're homebound, you have limited resources, or not necessarily limited resources, but you have limited ability to get to the store, okay, in the grocery shop. And they provide meals, prepared meals. We have our own kitchen, and they have the meals that you can put in the microwave and warm up. And they, if you, under that program, if you're a recipient of our Meals on Wheels program, we have what's called Anna Meals. So if you have a dog or a cat, we will feed your dog or cat, okay, as well. Congregate meals is where we provide food to the churches and different places where you can meet in the community. We provide a food resource booklet, as well as we can provide it electronically. For every day of the week, Monday through Saturday, there's always somewhere where you can get a free hot meal in the community. And also in this booklet, it provides a location of all the food pantries, what day of the week, where they're located, and the phone numbers. In the booklet, also, do you all know what the blessing boxes are? They're food boxes that churches and community organizations put out and put food in there, commodities, canned food, and there's a location of every one of the blessing boxes in Blount County. And we have update that on a regular basis as well. There's a grant, it's called RAMP, Rural Area Meals Program. Top of the world, it makes no difference where you or anybody lives. If someone qualifies and has a food need, we do our best to get food to them, and regardless of where it's at. So even, because I get calls, I live at the top of the world, and yes, we do go there, believe it or not. Or even in Seymour at the Blount County, Sevier County line, we go out. Anywhere in Blount County, our seniors are served. I don't know if you're aware of this, but we do what's called emergency food assistance at the agency. You have to come directly at the agency or call, and we'll contact the dispatch police department to have emergency food brought to you. We do this probably once or twice a month. We also have, we don't really advertise this, but because we have such a large number of homeless right now, we provide some of the toiletries that are needed. The deodorant, the toothbrush, ginger cream, shaving cream, laundry detergent, mouthwash, those kinds of things, toilet paper, paper towels, sanitary items as well. If you know someone in the community that has low resources and they cannot afford their briefs, they have incontinence, we get a lot of donations for them, and there is a nonprofit section at Homestead called Senior Needs, and we'll make a referral. We'll screen you for benefits, and we'll make a referral to them so you can get free briefs for men and women. I want to talk a little bit about our Smiles program. How many of you here are familiar with the Smiles Transportation Program? Awesome. There are several people here. We provide service within Blount County. Volunteers who are seniors drive our seniors around in Blount County. And I know that seems hard to believe, but we have currently 157 individuals enrolled in this program. It is a membership program. It's $25 a year membership, and you pay $6 a ride. It's a whole lot cheaper than a taxi cab, and probably paying for your gas right now, to be honest with you. It's offered Monday through Friday, 8 to 4. We do currently have a small waiting list, but our waiting list is only because we don't have enough volunteers. So if you would like to be a volunteer under our Smiles program, Miss Mary Mixon right here would gladly take your name and talk to you about that. If you could only give one ride, just one ride to one senior, and you get to pick and choose when and who. We use a software program that's user-friendly. You can pull it up on your phone. You can see what appointments are scheduled. You may want to take them to the doctor, but you can't pick them up. You can do half a ride. You can do what's called a split ride. And it is such a blessing to be able to provide these services to individuals, and our riders are the most beautiful, loving, caring people you could ever meet. I'm telling you, you will receive so much blessing from participating in this program. That's all we ever hear from our volunteers. It's like, oh my God, why wasn't I doing this a long time ago? Right now, we have 114 volunteers doing it. We need 100 more. I'll just be honest with you. We really, really need more volunteers. And I'm really pushing that, so if you haven't figured that out. You don't have to necessarily be a senior to volunteer, but if you got time on your hands and you're not working, then you should be volunteering. This program that was started in 2013 has been replicated in 24 counties across Tennessee, this model. So we're very, very, very proud of this transportation program. There's nothing like it. The volunteers do use their personal vehicles, and like I said a minute ago, they set their own schedules, and it's only within Blount County, and they're off the road by 4 p.m. Most of the time it's 3 p.m. So you can choose what day and where you want to go, who you want to provide the ride to, as well as how often. We just ask that you become a volunteer and hopefully do it once a month at least, or minimum once a quarter. Let's see. We talked about that. We talked about communication. The next program I want to talk about is SAIL, Staying Active and Independent for Life. How many SAIL people we got in here? 1, 2. You a SAIL member? It's a great class. It is absolutely. We started this several years ago, and it's an evidence-based on strength and balance for seniors, 60 and older. It's not high impact by no means. And it is very, very popular. We have volunteers who run the SAIL program, and you get a baseline when you come in, how you're able to stretch, your balance, they check it, so you can see at the end of this program how much you have improved. And you can vouch for that, can't you? Yes. Right now we have we have 2 classes at First Baptist Church. We have one at Fairview United Methodist, and it runs 6 classes each week, Monday through Thursday. And I've already mentioned about the volunteer instructors. And I'm not going to spend a whole lot of time on that. We can get you hooked up and more information if you're really interested in doing something like that. The classes stay full, I will tell you that. COVID caused a lot of problems. One, we're losing volunteers in our Smiles Transportation program, as well as having to be more distance in the classes, so the number of people in a class that can't be as close to one another. Last thing I'm going to touch on is our Safer Homes program, and we need volunteers for this as well. But this is where I was telling you where we do the installation of temporary wheelchair ramps and then eventually build a permanent ramp if it's going to be a permanent disability or mobility issue. We coordinate volunteers and we apply for the funding. We have a funding source out of Nashville that appears to be unlimited resources, just to be honest with you. We are allowed to apply up to $1,500 per ramp, and then we have other resources. If the ramp is going to cost more money than $1,500 to put together, that we can, there's local churches and other little grants that we have gotten. But we need volunteers for that. So it could be, you don't have to pick up a hammer or even drive a skill saw or anything like that. We need volunteers to bring snacks or help hand stuff during the build. We have volunteer coordinators in the program who will, if you don't know how to do a hammer or measure something, they will show you how to do it if you want to pick up a hammer. Mary can help you with that. There's brochures on the Safer Homes program, and Miss Joni Schaefer is our manager under that program. And Mary would be more than happy to sign you up under that program as well as a volunteer. All right.